Hi and welcome. I am Sarah Carnes. Thank you for joining us here for a wonderful Facebook Live to learn so much today from Dr. Trisha Bedrick. Thank you so much for being here with us today. She is the owner of NEOSkin in Hudson, and today we're kind of calling it MediSpa Monday, getting all of our questions answered about all the services they offer, about skincare, all of the stuff that we can be doing to help the aging process. And we're going to get into it today. So please ask your questions. So much wealth and knowledge here. I first want to start talking about, as we start to gather some questions here for you, Dr. Bedrick, let's talk about NEOSkin. You're in Hudson and you have a location there. Tell us about the services that you offer.
Right. Thanks, Sarah. Thanks for having me. So we're in Hudson, Ohio, right in First and Main, which is right off of 303 and 91. So we're a medical spa, and a lot of people say, well, what is a medical spa? You'll go to different medical spas, and they'll all have different services. But mainly, we started out with just Botox and fillers. Botox are for relaxing fine lines and wrinkles. Fillers are kind of to help us when we are losing some fat in our skin. We also do medical grade skincare, which helps as we get older. Our skin cells aren't just being very active; they kind of go to sleep. So we use the medical grade skincare to actually stimulate the skin cells so they stay awake. Then we also do laser resurfacing. So we have a halo laser that's kind of, I tell people, those sleepy skin cells, they're not making as much of your collagen. And so what the halo does, it's kind of like aerating the lawn, like where you poke holes in the lawn. We do a little bit of a controlled injury that the sleepy skin cell says, oh, geez, it sends a signal and says, you need to wake up and you need to heal this. And you need to make more collagen. And actually, we force it to make new baby skin. So that's what our halo laser does. We also have a Forever Young Photofacial. It's actually, we just got an upgrade on that. It's called the Hero, and that's kind of going to help you with redness, browns, that type of thing. So those are our skincare. Then we have a body clinic here. And in our body contouring clinic, we're able to freeze that with our Cool Sculpt Elite machines. So we always say you can squeeze it, we can usually freeze it. We have M-Sculpt, which is a muscle building technology. And we also have a machine called Axis Ultra, which is radio frequency and ultrasound that used to tighten the skin.
So you offer a lot.
Yeah.
So, and I just want to remind everyone to ask your questions about skincare, natural enhancements that you can do, any type of questions you have.
So we also are a little bit different in that we have a acne clinic here. So we have a full service acne clinic. It's all no oral medications, no harsh antibiotics, that type of thing. So we have a wonderful girl that runs that. Her name's Heather, and she's fantastic. I always say she's like your concierge acne specialist.
That's wonderful. Okay, so you named so many things. You offer so many services. Can you kind of tell me apart, because there's other medical spas like you mentioned earlier. What sets you apart at NEOSkin Med Spa?
So the biggest thing is I'm a family physician, and I'm not a dermatologist or plastic surgeon. And so when I started getting into aesthetics, my biggest thing was, why would somebody choose to come to me than a dermatologist or plastic surgeon? And my answer is that I will literally explain how the services work, all the, the risks, the benefits, any downtime, the cost. And I feel like that is left out of a lot of times in the process of getting these services done. And they are medical services, and I do think that they should be done. by, there should be a physician on site. There should be, nurses and doctors and a team really coordinating your care. So that's how I feel we're different. Like when people come in for a consult, it's an hour, and that does, it does include time to get services. But people are saying, oh, if I had this done, I don't need the consult. But what we say is like, we want to teach you the way that we think about it. And that way going forward, we don't want to just treat you now. We're going to treat you hopefully in the next 20 years that we're going to teach you how to think how we think, So that's, I think, the biggest difference.
That's wonderful. I love that. So we have a couple questions.
Oh, great.
Christina wants to know, how does one overcome sunspots?
Okay, that's a good one. And so basically, we're getting that sunspot due these little melanocytes. I always say it's like your hand. It's a pigment cell, and basically here's your pigment and your cell, and it sends up these little, I call them these little finger-like projections. And really, we're getting a brown spot because this pigment is trying to shield you from the DNA in your skin cell. So the first thing is how to overcome sunspot is to stay out of the sun. Second is to wear sunscreen and reapply it safely. But there are a combination of ways that we treat it. We treat it with our medical grade skincare. There's ways that we can use bleaching creams to do that. We can also use our Photofacial, which is light based, no downtime with that. And so we usually recommend a combination of therapies. We can also with our halo laser. When I said we kind of poke holes, if we poke a hole where there's a brown spot, we're removing it. So it's usually, and then we kind of have to talk about the way that the patient wants to, where do they want to start? Not everybody, I'm really not aggressive or not, I like to start slow. And some people would like, okay, I just want it done. What's the fastest way? And so we address all that.
Great. So Dawn would like to know, what type of products do you recommend for mature skin?
Okay, so maturing skin, and I kind of alluded to it a little bit at the beginning. The skin cell, the live skin cells at the very bottom layer of the skin. Okay, and his job, and I have these, like in my consultation, I have these raisins or these grapes and these raisins. Okay. So if you guys any of you have children, you take a picture of your baby and their skin just glows like this, right? That's because their skin cells are really active. And that job of that skin cell is to make collagen. So if I bite into that grape, you're going to see the fiber in the grape, right? So that's that skin cells making its collagen, the elastin and the bounciness and like kind of the juice in the grape, right? So every 10 years, that skin cell, it's a factory. Okay. And that skin cell just stops producing 10% every 10 years. So by age 50, you only have half the amount of collagen, right? So then our skin starts looking like that raisin. All right. That skin cell, that sleepy skin cell is still alive. It's just sleeping, right? So we just need to wake him up. We got to like fire up the factory. So so mature skin is just skin that's not very active. So then we really start with everyday medical grade skincare. Medical grade skincare is actually specifically designed where the active ingredients are formulated, encapsulated, if you be, to go through the dead layer of skin, the outer layer, through like where your collagen is, and then they're released onto that sleepy skin cell to like the active ingredients that will wake up the skin cell to make your collagen, your elastin, and your hyaluronic acid. So we here our number one that we use NEOSkin Center. It's Dr. Obaji's newest line, and the newer line I love just because the technology is even better. Helps us penetrate. So yes. the different products, you know, usually every good skincare routine has a good cleanser, a good toners. The toners are really important because it provides the right pH to carry your active ingredients down. We usually have ours has a daily power defense, like all the vitamins and minerals you need, the building blocks you need to make new skin, and then different growth factors that stimulate the skin. And then really still the holy grail is still retinols. And I always say that retinol is like kind of the coffee for the skin. It makes everything get up and go, so yeah, those are our basic ingredients. Now we do, customize for everybody. If we want a little bit of brightening, we might put vitamin C in there and things like that.
Oh, that's great. You can customize like that.
Yeah.
Taylor has a question here. She would like to know, do you have services that specialize in treating eczema?
So yes, we do. So really when we have a problematic skin, what I love about Dr. Obaji's line is really it's about strengthening the skin and getting it to act normally. So we have different systems for each one of those.
Great. I'm curious, you mentioned a bunch of different things that you offer at the beginning. And again, we can answer questions throughout. So please ask your questions. What should someone know? You mentioned Botox and fillers, anti-aging methods. What should people know about those?
Okay, so the biggest thing is like understanding like what product and what services is used to treat what issue you have. Okay, so a lot of times people will come in and they're like, I don't like my 11s right here, my frown lines are right there. I just don't like that. And I say, okay, well that is Botox, but let's explain like why you don't like it. And then I think we have this little picture here. I don't know if you can put that up, but really what we're trying to do is perfect. What we're trying to do is really, when you go to meet somebody or look at somebody, you go to look at the eyes. Okay. Your vision is attracted to the other person's dark pupil because the pupil's the darkest thing on the face. Okay. So when she's nice and young, my eye just lands directly on her pupil. And so that sends a signal to my brain that says, this is beauty. Okay. So as we age, there's going to become things on your face that become dark that we don't like. Like a lot of times people will notice this dark line here, right? And they don't like it because now you go to look at that dark line before you look at their pupil. So you're slowing down the beauty signal. You see what I'm saying?
Yeah.
So then you look at this mother in this picture, like I go to look at her pupils, but my eye initially goes down, is distracted by this, what people call that bag, right? That darkness. And then also my eye takes in the brown spots on her skin. My eye takes in the fold here, the shadow down there, and then I look at her pupil. So you can't, like, that's what people don't like about aging. They're like, well, I look at it when I was younger, like I just look so rested. It's just because your eye goes directly to the pupil. And then it just gets a little distracted as we get older. So all what we do here at NEOSkin is we use our products and our services to decrease anything that's dark on the face. So the Botox is really for the fine lines and wrinkles, and that's to do with the muscles in your face are the muscles attached to the skin, and your skin is slowing down and aging, right? So it's not as thick with the collagen. Yeah. So you're going to start to see when the muscle contracts, you're going to start to see that dark line. So we use for Botox, we use a little insulin syringe, and Botox is a liquid, and we inject it into the muscle. And it causes that muscle to relax. So if that muscle's relaxed, then there's no more fine line and wrinkle.
Got it. That's a good
but in that picture where that lady had that bag here, really, so you can see that darkness there, right? So that is a little bit more from fat loss. And I think I have a slide of the fat on the face, if you can show it. So your skin on the young girl, she's, her skin underneath has these fat pads. And when we're nice and young, we have a lot of fat in our face. And if you can turn to the other one, it's the one picture where you can actually see the yellow. Keep going. This picture right here is showing you that there's a lot of things on the face that lead you to the eyes. And there's something when we're young called triangle beauty. A small skinny chin and high cheekbones lead you to the pupil. And so as we age, we're going to have changes in the fat and changes in the skin, and our triangle goes upside, the kind of falls down. That's how we all look a little bit tired and saggy as we get older.
Yeah.
What we're trying to do is when we're correcting the things that are dark, we'll turn that triangle back right side up. So when we have to use, I was talking about the fat, so we might gain weight in other places on our body as we age, but we lose fat in the face. Yes, this is the one I wanted to look at. You see on the young girl there, if I were to peel her skin back, she has these beautiful fat pads there, and they're nice and full, and they're really close together. So when I put her skin over top, right, everything's well supported. There's no shadows. But on her mother on the side here, you can see that these fat pads got smaller, right? And especially right in the very middle right there, we lose a lot of fat in the middle. So then we go ahead and we take filler, which comes in a syringe, and it is hyaluronic acid. It's literally the juice in your skin. You have the liquid is hyaluronic acid in every skin cell. But the drug companies spin it and they make it into a gel. And then we use the syringe, and it's called filler because we're filling in the spaces that don't have any fat, right? And then we're giving that skin support from underneath. So that's how we get rid of that dark area. So that's why I like to go through a consult.
That is such a good visual.
With clients, because they don't understand, like, yeah, Botox is not going to fix that fat loss, right? But filler is going to address that. So we're always trying to explain to you why we're doing something, and then people will say, like, well, is there any side effects? Well, I'm putting a needle into the skin and I'm pushing a gel, right? So I could have some bruising, swelling, redness, product lumpiness initially, things like that. So we just want to make sure everybody's educated and kind of knows why we're doing things.
Yeah. And it sounds like that's the reason why you do the hour-long consultation, because you want to make sure they understand everything. Like, it was so helpful to see that visual, like you just explained.
Yeah. And again, that goes into the fact of, like, why would you come here? Because we're going to sit down with you and we're going to explain everything. And, your appointments won't always be an hour, but, we want to make sure that we're all on the same page. And we even give, like, your consult, like, it goes home with you on your phone and things like that. So, I used to have, when I first started, I used to have it on, like, a piece of paper, and, like, they, like, people might think about it for a year, right? And they come back and the paper's, like, all, and they're like, oh, but now I have it on their phone. So, I mean, they can discreetly, like, look at things and review things in their own time. Yeah.
Take their time to decide. So it looks like Michelle has a question, and this is something that's new to me, so I'm not sure if I'm even going to pronounce this right, but what is the best way to eliminate jowls?
Jowls. So jowls are part of that when when we were showing that triangle right side up, that leads you to the eyes. So as we lose fat in the face, and our skin doesn't have as much collagen in it, right? So when we don't have as much collagen, the skin becomes loose, and then we end up with these jowls. So a lot of times I say I use a lot of different approaches for this. I want to go ahead and make sure that we have fat, the filler up here to kind of pull things back up. Then I do want to put you on skincare because I want to get those skin cells active again and be making collagen. And then there's other things that we can do. We have skin tightening procedure called Exfoliation, which is a heat that I always say, like, if you think of, like, an old sweater, right, and it gets stretched out, and you put that old sweater in the dryer, it's going to tighten up, right? So that's kind of what, like, our skin tightening procedure is doing. It's it's no downtime or anything like that. It's using radio frequency and ultrasound, which creates heat, and tightens up those collagen fibers. So, and there's other things that we can do to mask it. Like we can put filler along the chin and the jawline. But yeah, so you can kind of see that there's a lot of different things we can do. But again, we just kind of work with your comfort level and the budget, and wherever you want to start, we can guide you through that.
Yeah. That's great. So Jenny has a question. She says, what are your best recommendations for readily available, like maybe at the drugstore or anywhere, just lotions for dry skin, or just making sure we're summer ready?
Mm-hmm. So with that, a standard, CeraVe over the counter is great. That actually used to start at a dermatologist's office. Those are good. Yeah, and the biggest thing is exfoliation is always good. Body scrubs are fine, things like that. Because really, we get that dry skin, and a lot of times it's just built up outer layer of skin that needs to come off. I always call it like the scab, and the reason I call it the scab is because if we get that off, then your products and your moisturizers will penetrate deeper. You see what I'm saying?
Yeah, totally. So I said this is the year I was going to start taking care of my skin, because I know there's probably a lot of women like me who life gets busy. It's not been a priority in our lives, but it's like, even this past year, I read an article that so many women are now, because of being at home more, or, Zoom calls where there's right up in
Yeah.
everybody's video cameras, we're paying attention to our skin more. So how do we know kind of what we should be looking for? And how do we know, oh, maybe this is something that I should look into because of this on my skin or that? Where do we start?
Well, my biggest thing is, and it was the same way, and then it's like, where do we start? What do I do? I don't want to, if I'm going to spend my money, I would rather make sure something works, right?
Mm-hmm.
So that's why I always talk about medical grade skincare and how it's different. So remember that alive skin cell, that alive but sleepy skin cell, it's starting to get sleepy, right? And not we don't want to look like the raisin. We want to stay like the grape, right? So you want to make sure, so medical grade skincare, actually you have to go to the FDA and prove that the active ingredients get down to the live skin cell. Okay. So everything else, and I will just say, think of everything that's in Ulta, everything that's in Sephora, even if it has a doctor's name on it, is not medical grade. So that's really important, because even though it might make it look, feel, or smell good, they don't have to prove that it penetrates and actually gets down to the live skin cell. So that's a game changer for me. And believe me, I've tried everything before I was doing this. Once I got to medical grade, I'll never go back, because it actually works, and the reason it works is because they had to prove to the FDA that it's penetrating down there. So penetrating down by the live skin cell. Once we start waking up that skin cell, that's what you want. And I always kind of say, okay, so if you go to the gym, right, you can't just go to the gym one time a year, right? You go to the gym on a regular basis. So you can stimulate that skin cell day and night, right? That's the exercise. That's what keeps it up. That's what keeps that skin cell awake and functioning, and keeping you looking like the grape and not the raisin. And everybody starts when they start noticing the signs of aging, and they just say oh, I just don't look as good, and so, for me, I felt like 32, 34. And then when I got closer to 40, then you're like, okay, now I'm getting serious. Okay.
That's where I'm at. Yeah.
That are okay, you say that works. Okay. I might have to go through a little bit of dryness and peeling if I can still look like the grape. So, but yeah, so that's really where it starts. And I always just say, even the start, you would not believe how many people just don't even wash the face every morning and night, right? And we got to get all that we want to get dirt and oils off because that will set us up for inflammation and things like that.
Yeah. So we have to remember the basics too.
Yeah.
Well, thank you so much for the time today and sharing with us. We had several comments from people at your office that just love you. So it can tell you have a wonderful staff, a wonderful office, and your patients love you. Just to wrap it up, could you tell us one more time just the basic services that you offer and where you're located?
Yeah, we're first in Maine and Hudson, right off of 303 and 91. Let's see, we offer Botox, we offer fillers, laser skin resurfacing, photofacials. We have a full service acne clinic. We have a body contouring clinic where we offer cool sculpting for fat reduction, M-Sculpt, which builds muscle, and Axilus, which tightens skin. So yeah, those are our basic services. We also have we also do something called, we do microneedling, we do PRP, which is like where we actually take growth factors from your blood and we needle it into the scalp to help hair growth, things like that.
Wonderful. Well, thank you so much today. We know we have the links all throughout the chat here where you can connect to them. You can go to their website, you can go to their Instagram and contact them to set up your consultation. Again, thank you so much for joining us.
Thank you.